My name is Trevor Schaefer. I was diagnosed with brain cancer in November of 2002 at the age of 13. I spent 8 days in the hospital post-surgery, followed by 6 weeks of radiation and 14 months of chemotherapy treatment. My mom, Charlie, was my primary caregiver, and as such, spent a lot of time with me in the hospital. We soon became aware of how prevalent childhood cancer is. My mom began doing research into why so many children were being diagnosed with cancer. In 2007, we organized a walk for childhood cancer awareness entitled Trevor's Trek. And in 2009, Trevor's Trek Foundation was formed to create childhood cancer awareness and engage in efforts to uncover the causes of childhood cancer and protect our children and communities from environmental contamination. Also in 2009, we began work on federal legislation entitled Trevor's Law to address and respond to cancer cluster concerns. On March 29, 2011, I testified along with Aaron Brockovich at the oversight hearing on disease clusters and environmental health in front of the Environment and Public Works Committee on behalf of Trevor's Law. Soon after that hearing, Trevor's Law passed out of committee with unanimous consent. After 7 more years of trips to Washington, D.C., negotiations, and at time utter deflation, Trevor's Law was passed and signed into law by President Obama on June 22nd, 2016. In 2019, I began working with the Centers for Disease Control as they initiated the process of updating their cancer cluster guidelines in accordance with the language of Trevor's Law. On December 8th, 2022, the new cancer cluster guidelines were published. One of the most significant updates to the cancer cluster guidelines is the addition of considering unusual patterns of cancer when determining a cancer cluster. And this is the premise of today's workshop. In addition to ensuring that Trevor's Law and the new cancer cluster guidelines get fully implemented, Trevor's Trek Foundation has developed a program entitled the Childhood Cancer Cluster Buster Program, where we are collecting childhood cancer data, mapping cases to identify childhood cancer clusters throughout the country, working with scientists out of the University of Arizona to study impacted communities and introduce the means to remedy issues in our environment. Specifically today, I would like to provide some suggestions for enhancing communication and engagement with communities about cancer clusters. There needs to be an ongoing effort to work with non-government organizations to develop a private network throughout the country of people that can keep track of cancer clusters in their local region. Some states have up to a year to report a cancer case. Reporting timelines need to be tightened. The time for all states to report a cancer case should be reduced to 2 or 3 months. In addition, we need to develop an online network where doctors are required to report a cancer case and the public can view a list of reported cases. We look forward to continuing to work with communities around the country to ensure their voices are heard and their concerns validated regarding childhood and adult cancer clusters in their community. Thank you.